Miss Davis?
Here.
Miss Cash?
Here.
Miss Kurtz?
Here.
Miss Lawley?
Here.
Dr. Patrick?
Here.
Mr. Bonnell?
Here.
Mr. Schul?
Do we have a motion to excuse?
So moved.
Second. Thank you. Bear with me, okay?
Oh, you're good.
Doing good.
Citizen comments. I don't think we have any citizen comments this morning, but we have two guests with us, and so I'm gonna have them come forward. Wipe your hands off.
Good timing.
Yeah, I know. Just, why don't you come right here for the board? This is really exciting. These are two high school interns. I think it's a new class, and I'll let them explain it, but I think it's a new class. They came to the city to do a tour, and they said they wanted to shadow the health department. So you can talk about your class and introduce your name. Introduce yourself, and then talk about your class.
I'm Bailey Warner. I'm Natalie Rickard. It's called career experiences, and so we basically just go to the class and talk to our teacher about what we might want to do in the future, and she sets up internships for us where it might fit our future careers best. So I was at an elementary school for a while.
Yeah, I tried getting into Atrium, but you have to get a bunch of testing and stuff, and it wasn't coming back correctly, and it was just a whole hassle. So we ended up reaching out here, and then they're like, yeah, sure, come on over. And so we've been here for a week. Yeah.
What's the area of education you want to pursue? Nursing, or we should talk about the
I
hospital?
was thinking just public health, just straight public health.
And they'll be with us until December 20th.
It's a semester class. So.
How often are you here? Every day but Wednesday.
Oh, wow.
For just an
Oh,
hour.
for an hour?
Yeah.
So it's like a class.
Yeah, like a classroom hour.
That's great.
This is right in line with public health's workforce development, right? Because you're trying to get people into public health, let them understand public health, and so I told them that we'll make it really interesting. We're trying to find a dog or cat or bat head, if anybody has one. This is our resident.
Anyone has any rabbit animals?
Yeah.
Send their head.
I think that's what attracted it to them when I was talking. I said, we have a head today. I think the guy brought a head in the day they were here. They got really excited. Yes.
Oh, yeah.
Do they need to see you, Dr. Genowine, since they were exposed to a bat?
Yeah.
As long as it's dead.
But what is really exciting for me is to just glean off, young people's brain and see what they're interested in, how they think the workforce will look like in the future, that kind of stuff. And so I told them they're gonna get tested for COVID themselves and make sure they go through all of that, make sure they go through all the grind. But we have, this is a school nurse, long-time nurse. I won't say a old nurse, long-time nurse on the board, Miss Sally, and then Miss Charlene works for the hospital in infectious disease, which is very exciting and important. She gets all of that. Mr. Bonnell at the end is a funeral home director, so it's very vital that we have, when we talk about mass casualties or whatever, it's a big, important part of where do you put the bodies, right? And a funeral home director usually has all the information of all the people that may have their coolers in the area or whatever, so it's really important. Miss Lawley, Ruth Lawley, is in drugs and addiction treatment and background, and so she's very interesting. Right now we have a large epidemic in overdoses and heroin and fentanyl.
I'll say fentanyl's a big one
Yeah,
right now.
fentanyl, so another good position on the board. Mrs. Davis is a longtime nurse. She's been a nurse forever, and nurses rock, once a nurse, always a nurse. And she worked for the VA for a long time, and then Dr. Patrick is a veterinarian. And so he would be the one that we would ask any questions about dog bites, rabies, any of that fun stuff. He always helps us tremendously. So we have a very good board with a lot of vast knowledge in all the different areas, so that if we have to start responding in emergency type of situations, a lot of our information and intelligence starts right here, so it's good. And then, of course, this is Dr. Genowine, our medical director. And so, that's it, ladies, you can go and catch up.
Nice to meet you.
Thank you. All right, thanks.
Are there any citizen comments? Hearing none, we need a motion to open the public hearing.
So moved.
Thank you. I hear a second.
Second.
Thank you.
So today we have the public hearing for food ordinance and campground licensing fees and the tobacco 21, of course. We sent out letters for the food fees, the tobacco 21, and I have not received any responses or objections to those fees. Campground, we just had one gentleman that asked if he had to be here, and I mentioned that he didn't have to unless he had some adverse comments towards the fees, so no other responses to those.
Is that all?
And no one's here, so that's the good thing, I guess.
Is there a motion to close the public hearing?
So moved.
Second.
All right. Approval of minutes for September. Just need another motion. Okay. Do I have a motion to approve those minutes?
So moved.
Second?
Second.
Motion approved. Motion to receive and file our financial report for September 2022. Do I have a motion?
So moved.
And a second?
Second.
We have our motion and second. Is there any old business?
Just FAB, two things with FAB, we're still waiting. Remember, our report should come out in November, so as far as our accreditation status. And we are beginning the CHIP, the CHOP, which is the Community Health Assessment. We are getting those contracts back from two people. One used to work with Wright State, one was the one that did our community health assessment years ago. So Butler County is getting the information with these two ladies that will conduct the community health assessment. And that means we'll start getting the data together and doing focus groups, et cetera. So they'll be leading us. And we'll share the costs, we being Hamilton City Health Department, Middletown City Health Department, and Butler County. And I think it will be around, I think we said something in the last meeting, was it 20,000 divided by all of us, and so to be continued, but it's, we'll bring that back to the board once we get started, but this is all part of the FAB, what do you call it, the FAB budget, I guess, because we have to do this every 5 years, you have to do, every 3 to 5 years, you have to do a new community health assessment. So that's what's going on now. After you do the community health assessment and you find out what the community is in need of, we move right into the community health improvement plan, which they call the CHIP, and you focus on those. They probably won't be a lot different than before. They're usually infant mortality, it's usually drug addiction, mental health. So usually you're working on that improvement plan for more than the 3 to 5 years, but you have to do assessment just to make sure nothing else emerges. And they're really concerned with COVID on top of, on the community, on top of all the other ills in the community. And so it'll be interesting to see if it's shifted. And maybe people may say, we had mental health already with drugs, but they may into safety concerns more. They may move into another area of concerns. So we're interested to see what the surveys are gonna look like. But that's all that's going on with the old business with Fab. Fab will always be kind of our old business. It'll just be always there, what's new with Fab. So. And for the other ones, Fab is Public Health Accreditation Board. That's what Fab started, and it's a P for Fab. Yeah, yeah, Public Health Accreditation Board. Yeah.
Okay. Our new business. First is travel authorizations.
Oh, yeah, and we're gonna do the education part, I think, first. Education presentation, okay? And we have brought back Miss Christina Lotta. I always say Lotta, but I said it, what's your,
Lada Landefeld.
yes,
Lotta-
there you
Lotta
go.
L's.
Yeah.
That's fun.
And-
Yeah, really.
Yeah, Lotta. And Christina presented to us before about Tobacco 21, and so she's gonna give all the group just a recap since we're approaching the new ordinance, so.
Yeah, thank you so much. Should I just ask you to sort of advance as we go along?
Yeah.
Excellent. Well, thank you so much for welcoming me back. It's been a few years. We had a little gap. Let's call it a gap. But I'm really excited to share some updates with all of you in terms of progress that's been made very recently and right here in our own backyard. So what we're talking about is tobacco retail license that supports the Tobacco 21 law. So when we first started this, I think actually when I presented here last, this was before the federal law went into effect, and then very quickly, I actually forget, it might have been the state and then the federal, but they were like back to back. That passed in 2019 to make all tobacco sales, which included all nicotine products, to move from 18 to 21, right? And so there was a lot of conversation at that time about what is the right age in terms of effectiveness for sales. So knowing that at 18, and I just talked to two people back here, both of you are 18 or just one of you? Just one. So one thing in terms of this effectiveness is when you're 18, you still have access to a lot of your peers who might be under 18. So a big reason for that shift to 21 is because it gives you a little bit more gap between access to people who are younger. So it's really all about trying to decrease youth access to tobacco nicotine products. So I'm not reading off the slides. You guys can read those as you would like. But I'm just giving you a little bit more background. So we can go ahead and switch to the next one. So I just talked about some of the risks in the youth community. So the one, thank you, 2020, so Centers for Disease Control and Prevention, CDC, 1 in 20 middle school students and 1 in 5 high school students reported using an e-cigarette in the past 30 days. I just found out through the Ohio Health Policy Institute, I think that's what it's called, those rates locally, at least in Ohio, are back up. So we saw a dip, and we can go to the next slide. In Butler County, this is the 2020 data. 2022 data is out, and what you'll see in that black line right there, so the past 30-day use, the black line is e-vapor, so e-cigarettes. And we know that that's a device, right? So it's not a drug, but what we know is that you've got both nicotine products and THC products that are being used in that device. But what we saw for the first time ever is the use amongst youth of any substance that e-vapor, e-cigarettes surpassed alcohol. Alcohol is always the #1 used substance. Major concern, 2022, we saw a dip. What we're hearing now and seeing now is that that has come back up. What we think part of that dip is because when everybody was back home, there wasn't as much easily access or use amongst peers. So you're out of the schools, you're back home, less access. But now we're seeing that come back up. We have to switch. So what is a helpful solution is tobacco retail license. So tobacco retail license is a comprehensive, non-criminal regulatory tool. Let me give you a quick example. You may have seen last week there was a bust in Hamilton. There were 3 vape shops. It was with the Butler County, the burn unit. I'm forgetting forgetting what the acronym stands for right now. But between Butler County and Hamilton Police Department, they were able to work together, and they were found over 300 products that were being sold in these stores, just one store alone, that had THC in them. So, one, there were illegal substances being sold. Secondly, they were also selling to under 21. Because the TRL has been passed in Hamilton but is not gone into effect until next spring, they don't have a license. They weren't able to have those revoked. It is a criminal charge, but what we can see is that this is desperately needed, right? Desperately needed. So what this tobacco retail license does is it allows for those retailers to say, okay, you want to sell tobacco products. We're not talking cigarettes because there's a separate license for that at the state level, but any tobacco products, including any paraphernalia. So if there's a shop, they sell any number of other things, but they also sell paraphernalia, they also get included into this tobacco retail license. And the point is that you make it as broad as possible to make it less likely that people can find loopholes. So they get a license, they pay an annual fee, and this helps close that gap between this tobacco 21 law that says you have to be 21 in order to purchase, and then what do you do to actually enforce it? Go ahead. So here's some benefits of TRL. It protects youth in our community, holds the retailer, which means the owner, responsible. Again, going back to that Hamilton example, the only person that they were able to hold responsible was the clerk. The clerks tend to be underpaid or low paid and younger people. This holds the owner responsible. And then it funds the enforcement through the fee structure. And we can see that in Cincinnati, thank you, and all of those, the ones that are orange have links to their programs. So you've got access to this. If you wanted to take a look at these local programs, you're welcome to do that. Columbus has a tobacco retail license. Cuyahoga County has a tobacco retail license. Cincinnati, and theirs is, we've been working very closely with them. And you can see at the bottom there that tobacco 21. We're actually going to be using some of that branding in Hamilton, but obviously it won't say Cincy, it'll say Hamilton. But there's a lot of great marketing pieces out there to help increase education around that. And then we hope to help spread that out across the county as different cities and hopefully the county will also put these into effect.
I have a question about
Yes,
that.
ma'am.
Are there retailers who are willing to put out that campaign material for you guys? Like partner? Like we're not selling to.
Right, so the process that Hamilton is in right now, and I'm just sharing Hamilton because it's just a little bit ahead. So it's been passed, and the next thing is, and this is actually part of it, to get this program up and running, there are costs involved. And Interact for Health, who has funded this program up to this point, what happens next is Hamilton then applied for implementation funds. And some of those implementation funds goes towards this education of retailers to help get them up and running, which includes window clings, clocks that show how old you what is the date of birth to be 21, things like that. Yeah.
Just showing retailers are on board.
Yes.
Okay.
Yep, they have been, and there actually were a couple of retailers that reached out to the health department in Hamilton who said thank you, that we actually are happy to have this be in place, and thanks for the support. So this is just a little bit of information. What the health departments around the county have been trying to do is really collaborate, make sure that this is not one single program, they're individual programs, but that we're all on the same page. So you see up there the license fee is $250. That is what Hamilton has chosen to do. Cincinnati is $500. They have a lot more retailers. Their program is much more expensive, and $500 is what they chose. I'm sure you can imagine if Hamilton's retail license was $500 and Middletown's was $250, that might incentivize some retailers to jump borders and come open here. So one of the major points we want to make sure is that we're all in the same fee structure and fine structure to make sure that all retailers know Middletown, Hamilton, wherever you are, you're facing the same program. Yeah. All right, go ahead, thank you. So the fine structure, this is one question that most boards of health really are concerned about, is what happens when they sell. So again, this is built off of Hamilton's, but we would hope that the other health departments are sort of working in lockstep with this. So also, just of note, this is the Hamilton retail license is best practice, and that is the one that Middletown was built off of as well. So we've got all the stamps of approval from all of the anti-youth tobacco organizations from around the country are saying this is best practice. All right. And then this just shows what happens next. How do you implement this? And so I've got the Interact for Health up there just to say again, there are costs involved, but Interact for Health is willing to help fund the city of Middletown to help get that off the ground. And that's it. Do y'all have any other questions for me? Yes?
What happens if they just don't listen? And what happens if they keep selling it, or they just don't even pay the fee or the fine? And that's kind of what we saw originally with the tobacco problems in bars, was certain ones just ignore it, and then there were no teeth behind it to do anything about it.
They get their license revoked.
And they keep selling. What happens then?
Then there are, I think it can go into criminal at that point. So it goes into, I think, misdemeanor 1, maybe misdemeanor 4.
See, and I think when Carla, correct me if I'm wrong, but when we had a meeting with Cincinnati, I think they said there was something like 98% compliant, as it is some that just ignite. And they said that they will take that.
But don't you think they're the ones who are the problem to begin with?
Well, yeah, but some
I
people
mean, they're the ones that are probably selling to the underage
yeah.
and don't care about what's in the ingredient in it. That's just my,
Yeah, right.
coming to
It's
my
almost
mind.
like, Carl and I talked about this a little bit, as far as all of our rules, there are some people that just do not comply.
Yeah.
Just like when
But
we
the people
fight
who are
with-
following the rules
when
now
you
are
get
the ones who are
fined-
gonna pay this and
Yeah, and I think
continue
they'll,
to follow the rules.
right, and they'll continue to get fined, so at least you're getting the money to continue the education. And you can probably, when you do your newspaper articles and say, everybody in Middletown's doing this, except one particular, I mean, you could probably know who's
Public
not
shame.
fined it, public
Yeah.
shame, yeah.
Seriously.
But no, I'm not, they were, because I said, what about that? And Carla's like, it's always gonna be that one person that you don't get that. But they do get fined each time. And you can revoke, I mean, they don't have a license. So they're just they're just getting fined, and they may pay it every year. They may feel like, the $500 is fine every year, you're still getting. And then you have to take them to court. It is a process. It's in the ordinances, as far as what to do, but.
And we've learned an awful lot from Cincinnati. I mean, and I think one of the main things we've learned is that it is a process. So if this program goes into effect starting in the spring, we might not see even 98% compliance in the first year, but maybe it's 85%, and maybe year 2 is 95%,
Yeah.
and year 3 is 99%. So I think that's the benefit.
Right.
Right now, the shops that I talked about in Hamilton, they're open. They're open for business right now.
Yeah.
So with no rules, with no teeth, you get continual breaking of the law and nothing behind it.
I think they said you have to know what you're comfortable with, what you're comfortable with, and it will decrease access, even if it's not 100%. It will decrease access, and so. Yeah. And then you do get, like you said, you get the money to continue the programming of educating, and sometimes our younger people or parents may not even know. I know a lot of people have no clue what they're doing in vape shops, or that they are vape shops, because they pop up everywhere and they can have all of, yeah.
Well, the high school kids they're 10 steps ahead of everything. I mean, they
You should see the smile you got behind your.
they set up Venmo. They have
Very
some
innovative.
21-year-old that goes and purchases everything. They deliver it by Uber. It's impossible. It's impossible to keep up.
Yeah.
Because a cottage industry just picks up every time a 21-year-old walks in and stocks up on the vaping stuff.
Yeah, as I guess just a quick aside, we, in Vision Partnerships, we've made a slight shift recently from Tobacco Policy Coalition to Policy and Advocacy emergency coalition, because we know that we can't just, this is not just about tobacco 21, this is not just about vapes. This is about, we have to constantly stay engaged with our local representatives, with our law enforcement, with, you know, people across the board, with our boards of health, to understand, with youth, to understand what's happening and to stay, really try to stay as agile as we can. Because like you said, it just is, it's moving rapidly.
Thank you.
Thank you all so much for your time.
Okay, travel authorizations.
There is a travel authorization in the packet. There is no fee and cost associated with this travel. Chandra will be going to a regional epidemiology meeting, and it is all day. I do believe the city's policy is any cost to the city when you need a travel request, and that can be just your time away from the office, more than 8 hours, and so this is in there. And Chandra, you have anything else about the meeting that you want to mention, or?
Yeah, it's a training, the first part of that day is a training for healthcare associated infection. Ohio Department of Health is coming down to update us on what's trending, and then how to handle it. So any of our nursing home outbreaks, specifically will be discussed. And then the second part is our usual quarterly ready meeting. But it's a required face-to-face meeting. We've been doing everything online, but this is a required face-to-face meeting for our grant deliverable.
Okay, our second reading,
Do we need a, yeah, a motion for that. So, yeah.
can I have a motion?
No, she needs a motion for the travel authorization.
So moved.
Second.
Thank you. And then the second reading of the MVHE ordinance number 2022-01 food licensing fees. Do I have a motion for that?
So moved.
Hang on.
Wait, I think we want to make the motion to read by title only all of the second reading.
Okay, so I'll correct myself and do it, ask you that for all. And those are MVHE 2022-01, as well as 020304 and 20204 and 20205 by title only.
Correct.
So do I have a motion for all of that?
So moved.
Second.
Approval of agreement between City of Middletown Health Department and Emergency Preparedness Coordinator, as well as 2022 third quarter report. Motion to read.
Yeah, now,
those two.
the City of Middletown Health Department Emergency Preparedness Coordinator, every time we do this is a workforce development grant position, and we believe we found a good match with this individual. She will be working in the emergency response planning and getting our plans up to date. She is a graduate of Miami University in the School of Public Health, and her specialty was epidemiology. And she's a Middletonian. And I say that not because I don't like other areas. It's kind of nice to get younger people that lives in the city. She lives on Central. And so therefore she'll have contact with her other younger people. She's interested in geography. And so geography and public health means why do things happen more in certain areas than others? Or if you set up traffic patterns, how that makes a street more healthy. And she was telling me, she said, I love what they're doing to Central downtown, because when you go past trees or things, it makes it feel like you're going faster, so it automatically makes your brain slow down. So it's certain things that she knows about, they study about how to make communities healthier just by the way we situate things, or what we put into them. And so, with this, public health worker contract that we'll be approving, we have those for all of our public health workers, but every time you hire somebody, you have to have it approved by your board, and it has to go through legal as well. That's why it's coming before you. This position is 100% paid through the workforce development grants, which we have information that that grant should go out to 2027. So it's pretty nice that you can hire somebody and keep them around for a while as well, while you wait to see what budgets do. And last but not least, she will be probably going back to get her master's at Ohio State. So we'll at least have her for a year to get us through all the updating plans or whatever. But then she thinks she could still work with us because she may be doing that online. She's not sure yet, but so we know we'll have her around for at least a year. But another good addition to public health workforce.
And that is that.
And that is number
specialist.
7. Yeah, approval of agreement between City of Middletown and Emergency Preparedness Coordinator. That's, I'm looking at the new, yeah, that should be number 7. And number 8, when you said the quarterly report does not have to have a motion and approval, it's just presented to you.
All right. But I did skip the specialist or environmental health specialist in
That-
training.
Yes, that's all part of number 6.
Okay.
Yeah, any registered environmental health specialist or environmental health specialist, that's all part of the ordinance 22-05.
But we still need a motion on 7.
So we have, you did correct, Sally, in doing 2 through 6 was reading by title only, and we did that, and we have a motion and a second on those 2. And then number 7, we'll need a motion and second on the emergency preparedness.
Okay. Can I have a motion on 1 through 6?
So move. Second.
Thank you. And now may I have a motion for approval of agreement, number 7?
Yes.
So move.
Second.
Thank you. Okay, reports.
Yeah, and number 8, I was going to just mention really quick, that's a quarterly report, and we need to add on that, we were putting surveys along with our quarterly report that's in the packet too. So as we get surveys in every quarter, we'll show you what the surveys are indicating too. So that would be a quarterly report / surveys the next time on the agenda too. And the reports, I handed out your paper on the reports just to put it in front of you, but the only thing I wanted to bring out, to point out, monkeypox, of course, holding steady, still only 3 in the county. And our Chandra will speak about this a little more, but our clinic was very full last week for the boosters, and so we also have paperwork today if anyone is interested in a flu shot. So that is that time of year for the board.
Your boosters contain the new,
Variants, yeah,
Variants.
so they're bivalents, yeah, 4 and 5 is in the boosters. And I had one on each arm yesterday, so I'm doing good. I'm thinking I was gonna call off for the board, but I woke up this morning, so.
and what are your plans?
I woke up this morning, so I'll be,
Are they?
yeah, Yes.
Still with first and Thursdays.
yeah. And so if you guys want those two, it's nice that bivalent's in a vial of 5. So remember when we had to try to find 20 people or whatever to do booster 5, so we usually can round up 5 people to get those to them. And the grant that we're working with the Safety Council, we continue to work with that, getting our primary data. We did the data walk. So this grant was, we call it Middletown Connect now. It was at Ohio, vulnerability zones. We did a data walk with our HIP people. HIP means Health Improvement Partners. And it was surprising, census tract that we're focusing on, 130, 131, and 132, has no dollar stores. That's that's usually in every poor community. So there's no dollar stores in these census tracts. 1, no laundromats. 2, no grocery stores at all. So when we looked and see what was in it, they're drive-throughs, or they're little stores that have information on it like tobacco and wine and beer, you know, or sexy bodies and that kind of stuff on it. So they're not even like a little corner grocery store. And so we start thinking about when kids, and we're talking about Rosa Parks and Amanda area, right? And when they go to school and if they're dirty and there's no laundromats, and we said this area also has low transportation rates. So how do they get to laundromats? How do they clean those clothes or whatever? So it was really interesting when we did the data walk around the room. And it's just a process where you hang up things and say, what do you think about these, what do you call it, data marks that we found. Also, we looked at it and going a little further, they live 12.5 years less than any place else in Middletown. So we're looking at, they also have more chronic illness, COPD. And so we're just diving into the information. It's sobering to look at that, but we're thinking that maybe what will come out of it on the low end would be civic engagement to let the community know. So we're gonna start talking to the community. Did you know that? And what do you want? What's the questions that we need to ask about this? So we're still finding out very interesting things. Although you think you know it, it has a wealth of churches. And so that's one of our, you know, what do you call it, advantages. So we can work with churches to help the community too. So more to come. Health budget, our health budget will be presented to City Council on the 18th, so that's next Tuesday. Last Tuesday, they presented public safety, fire and police, and so the next one is non-public safety budget. So it's not only the health department, but it's all the rest of the city's budget is next Tuesday. And overdoses are up to 37 and with pending, so we're continuing to see that. Let's see, housing meetings continue. We have a draft report out. It's like 48 pages. So if you guys want that, I'll just send it out to everybody in a link so you can grab it, because it's probably easier to do it that way than to print out those if you want to look at it. But it's a pretty interesting report. This is Butler County Housing Report. They did an assessment. Our action circle, Sally, if you want to maybe report on our mental health one, we had a large group with mental health and it was a good.
You'll have to help me with all the members that were there because there were a lot.
A lot of people there.
And I don't know their names, so, except for Jamie Sharon.
Yeah, yeah.
And the police were represented. We had Jackie.
Thomas Hall, the representative was there. Our House representative that was sitting next to Jamie Sharon.
Okay, I never met him. Why don't you know all the people
Well,
that were there?
What I like about Action Circles is it's a community roots thing. So people come to us, and it was Officer Luss, Jim Luss came to us concerned about mental health and how there's loops and cracks and gaps in services. And so we brought those people to the table. And so everybody's talking, and don't you think everybody's frustrated because there's
Yes.
certain things that their hands are tied. I can build this, but I can't build that. I can have Ruth as a client, but if Ruth wants to go to Carla, I can't take her because she's already a client. So it was people sitting at the table kind of hashing out how they can make it, maybe close the gaps or what they can do. And it's nice that you have a representative there at the state that maybe can change policies. And so we were looking at that as well, the frustration of what to do. Crisis, Kettering was there, a Kettering representative was there. And so I think it was a really good meeting. And I think what Jim will find, because he was a concerned citizen, is it is very complex, right? You just can't change it overnight, but you'll make small gains with them. And then that people are listening and they're coming to the table to have the judges' time and a state representative's time. It's really important that you have that feedback. Did you get anything?
There were other mental health facilities involved too. I don't know what they are. We should start listing all that.
Yeah, they were like Sojourner, Access Counseling, Mental Health Board, looking around the table. So there were people that worked with mental health / addiction that was at the table. The people that kind of serve the community. And I had to leave early because I had to go to a Butler County meeting, but I'll find out what the next steps are because they may need to get all mental health groups in there. But I know that Mental Health Board is still talking about how to get resources. Remember, because the resources, they'll say, we didn't know to do this, and how do you know to do that? And it's hard to keep that, you have to keep it up. Every time you do a card, somebody's out of business, or someone moves. So you know how frustrating and hard that is.
It is hard.
Yeah, who to call, so it's gonna be work to be done, and what's good about action circles, you kinda get some small gains and some, short-term goals done, as we try to fix those long-term.
And to at least, change community awareness
Mhm.
of where facilities and services are. That's important too, so marketing's gonna be a big thing with that, I think.
Absolutely. And there's mental health board agencies out there that have money that can do that too for community. That they're supposed to do that, they can direct it in a certain way, so. That is one of the action circles, and the other one, the Unhouse Initiative, a group did go to Florida, they did look at the Dignity buses, Cindy Carpenter went with them. Cindy Carpenter has a church identified in Hamilton that might be like the Source. Excuse me, when they went to Vero Beach, it's a church or a spiritual organization called The Source. And The Source was almost like Jeff Diver's self. It did a whole lot of things, helped you get birth certificates, helped you get certain things. And then one arm is the Dignity Bus. And so Cindy Carpenter said if we could get someone, I think she said a Pastor Russo that is at the New Life Mission in Hamilton, if he can become the source and then have an arm of a Dignity Bus, that may work. So all of that is still in the talks. So it's exciting that way, as well as we still have a city person here that is working with the churches to do a project like Shalom Project to happen, so. And then I have a thing here, if you guys do not know, Rodney Muterspa is supposed to be working with downtown businesses, and he's having a town hall meeting tonight on the 4th floor about the unhoused and downtown businesses. Everybody's welcome though to come to see, but that's tonight from 6 to 7:30, 4th floor. And so that's all about the Unhoused Initiative. I already spoke about FAD, and I already spoke about the workforce development with the new person coming on, so. That is the end of my report, unless anybody has any questions.
Dr. Gentleline?
Well, to start, we have our reportable illnesses. We had 13 chlamydia, 14 gonorrhea, 8 hepatitis C, 1 salmonella, 1 streptococcal group A, and 1 botulism, the wound. In your packet, there's also, we're kind of through the ones to compare. There is the HIV count, positive cases. If you remember last summer, there was quite a surge of HIV cases, particularly in the summer, which we really didn't have a good explanation for other than, kind of typically blaming everything on COVID. But this year, the numbers have dropped much more to what seems to be more on par with averages for us, and actually year to date we're at about half of what we were for 2021. So,
Dr. Gentleman, did you say you've had a case of botulism?
that's what was reported, yes.
Isn't that a little unusual?
In a wound, it was
With the
a
womb botulism,
homeless person
Yeah.
living in a shed behind somebody's home. and-
IV user.
Yeah,
Drug IV
kind of a
user.
complicated, very complicated medical history. Yeah.
Have you heard the outcome of the patient?
No, at this point, there's been no confirmed tests entered into the reporting system that it was botulism, so he's still considered a probable case, based on his clinical symptoms. The last report I got back from the physician was that he was improving. He had regained pupillary response and some hand movements. That was a couple of weeks ago. I have since emailed asking for an update, got no response, so I was just provided with a new contact with infectious disease at the hospital where he's was admitted, so I can hopefully track down some more information through infectious disease. But yeah, there's been no lab tests at all entered into his system, so it's still kind of up in the air.
Does that go to the state for confirmation?
It goes to the CDC for confirmation through the state.
Yeah.
So, yeah. So more to come, hopefully a more thorough update next month.
But they must be reporting to Butler County, because it's on the Butler County report.
It's in ODRS.
think that's
It's
what
in
we're getting from
ODRS
the
as a
report.
probable case,
Mhm.
because of the clinical, symptomology is clinically diagnosed.
Oh, with that said too, we may have a syphilis downstairs too, in the jail, so that gets interesting. And with that, they need shots of penicillin, and so we'll work with them or the jails to get that down. The good thing is we know where they are. Sometimes you can't find them, it's very, yeah. Yeah. I've been looking at that last night and this morning, I sent that to you, so, yeah.
Chandra, do you have a report to give?
I do. So Jackie had said that our clinic was robust last Thursday, and I loved it. The girls here were great sports on helping me set up the clinic, because not only were we expecting a lot of people, but we also had to change to a smaller area because council chambers is being worked on. So we shrank our location down to the training room at the bottom of the stairs downstairs, which is much smaller. So we had to move all the furniture around in there, and they were great sports about it. We wound up doing 82 boosters in an hour and a half, along with 6 flu shots. And we did some home visits as well, so it was a great day. I love it when the numbers are up over 30 for that hour. We actually had to open it up because the schedule was filling up so quickly. We opened it up to an hour and a half to accommodate more people. It was great.
Do we have a combination
No,
of
they don't come.
COVID and flu, or is this strictly?
Individual shots, but you can give them at the same time. And just for your own knowledge, because we've been giving boosters for a year, but the only vaccine that you can use as a booster now is the one that comes with the bivalent, the Omicron B strains in it. So if you go in anywhere, be it us, pharmacy, doctor, and they offer you a COVID booster, it is going to be a bivalent. It's the only one licensed for boosting at this point. And as of right now, it's you get boosted and you're done at this point. So more to come in the future as they see what comes around the corner with any new strains or resurgence of infection. That being said, if you guys, because Jackie did say that the vials now come in only 5 doses, which means opening one up is less stressful about wastage. So if anybody today wants to get their booster as well as their flu shot, or one or the other, let me know, and I'll take care of it before you all leave today.
Or if we open it up and you guys wanna come later, cause it's still the 12-hour
Yeah.
window, so if you guys want to do it later too. That's it.
We are in the we finally finished our first round of inspections, so we're starting a second round, which has to be completed by February the 28th. We've also finished our 5-year septic inspections, finally. I think in the process of doing those, we found a couple of homes that had placed in septic systems without permits. So we're trying to address at least one of those if the homeowner gets us the information, because if you don't get a permit, your system is really not approved. So they did give us the person that put the system in, so we're trying to work with him so he can get permitted, and maybe we could look at some of the system that they put in. So we are finding that they're putting them in without permits from the health department. We have a couple of new mobiles that we're working with. Initially, they were disapproved for not having all their information submitted, so we're working with them. One's called Fatty's, and the other one is Liza. So one's pretty much a hamburger type facility, and the other one's like donuts, sandwiches, and cakes and things of that nature. This weekend we have Hocus Pocus, so we'll be doing an inspection out at Hocus Pocus on Saturday. We have a tabletop exercise in November for anthrax, so most of the staff will be attending that event, and that's at EOC.
Yeah, emergency management down off Princeton Road. I think that's where the location is.
Yep. And we have a new bar that's opening. Actually, it was open, it closed for 6 months, but this time it's gonna be called Rusty Nail. It was Phoenix. So we have a bar that's going back in. Other than that, that's it. Just we still have 3 septics that that haven't been connected, that are in courts. We're waiting for them to be processed by the prosecutor, so we're still waiting on those. They haven't connected to city sewer. That's it.
Can I ask, how's the new Steak and Shake doing? Because we had so many problems in the past.
We did go out a couple months ago where they were having some issues, but they got everything taken care of. So, they had some management change. So hopefully, they did kind of dip to a little dip. Yeah, but they were back in compliance, so hopefully they'll maintain compliance. But we'll keep our eye on it.
I got one last mention. Ruth and I are meeting with Anita Kitchen. She gave me the contact for the director of Family of Addicts. I think she's a
She's the
Dayton
executive director.
executive director. So we're meeting with her tomorrow, which is exciting, because I have 3 families that are interested in starting a chapter. So I wanted to meet with her first and get that contact, and then that will be Bobby another kind of setting up another action circle to see, and that would be just for supports of families with addictions. So, and I have to just see how, with all the rules, regulations, how easy it is to do, and then probably give her a contact of one of our local residents here that want to start one. So that'll be tomorrow. So thank you.
Does anyone else have any comments or questions or concerns? Are we ready to adjourn? Do I get a motion?
So moved.
So moved.
That was quick.
So the rusty nail, do they give
I
shots?
haven't